Good morning, sir. Good morning, my seniors and my colleagues. I'm Dr. Pranav, and today I'm going to present the paper on clinical outcomes of O-arm navigation-guided MISS TLIF. The minimal invasive transforaminal lumbar interbody fusion, MISS TLIF, decreases the rate of morbidities related to the open surgery. It reduces the back muscle injury and improves the clinical outcomes. The percutaneous pedicle screw insertions with the fluoroscopy gives only two-dimensional image guidance, which may lead to the higher rate of screw misplacement due to the lack of visibility of the anatomical landmark and lack of tactile sensation while putting the screws. The 3D navigation gives exact 3D orientation of the anatomy, thus it decreases the operative time, blood loss, and it decreases the screws-related issues, thus giving the best possible outcome. The aim of my study is to analyze the clinical outcome of the O-arm navigation-guided MISS TLIF. It is a retrospective study carried out at Stavya Spine Hospital. The inclusion criteria are age 18 to 80 years. The one-level fusion was performed between L3 and S1. The 3 months of the conservative trial was given before the surgery. There is no history of any previous surgery at the affected segment, and at least a 1-year follow-up was there. The indications were the lumbar disc herniation, the spondylodiscitis, and the lumbar stenosis. The various parameters that are measured are the time for surgery, the estimated blood loss, the VAS score, and the ODI score for the back, and various complications are noted. The follow-up range from 1 year to the 3 years. The operative protocol at our institution is the patient in the prone position, then the quadrant retractor is docked at the most appropriate level. After that, the loop-assisted facetectomy and the cage insertion from the most symptomatic side is done. After that, the reference frame is attached either to the skin with the help of the sterile tapes and the sutures, or to the spinous process with a mini open incision. Then the pedicle screw placement under the O-arm navigation using the pack probe and the owl tip tap. After that, the conformation CT spin was taken to see for any breaches, and the wound closure is done. Total 213 patients were operated. Out of that, the complete data is present of 170 patients. These are the demographic data. The mean age was 47.68, 60 males and 110 females were included. The L4, L5 is the most operated level, followed by the L5, S1. The hypertension and osteoporosis are the most common comorbidities present in our patient group. The most commonly operative indication was enterolisthesis in 101 patient, followed by the disc prolapse. These are the various radiological criteria which were noted. With grade 1 listhesis is seen in 68 patients, and the seizures of all the patient was done. The foraminal stenosis, the grade 3 foraminal stenosis is seen in 49 patients, and the MSS grade were noted. These are the clinical outcomes, and these are the clinical outcomes. The ODI and the VAS score for the back and the leg is significantly reduced in our study. The time required for the operation was 130 minutes. With standard deviation of the 30 minutes, the blood loss was 102 ml. The various complications were noted. The intraoperative complications, the grade 1 screw breaches were seen in 34 out of the 680 screws, which were that was grade 1 and was acceptable. The same-sided radiculopathy and the opposite-sided radiculopathy and the superficial infections were noted. And there is one one neurodeficit patient. One neurodeficit was noted in one patient. That is ankle foot drop, which didn't record. Otherwise, all the other complications were reside with the time. These are the various PubMed published studies showing the similar outcomes. In all the studies, the ODI and the VAS was significantly decreased, as in our study. These are the papers published by the Kangbu Shen et al. And the Verasak in the PubMed, showing the favorable outcomes with the navigated MISS TLIF. And my conclusion will be that 3D navigation is a useful tool for MISS TLIF, giving the best clinical outcomes with the minimal tissue injury and with greater accuracy. Thank you.